So recently, one of our past postdocs, Dr. Brittany Curley, conducted a really amazing study, and we looked at the difference between NSC percentage in feed and the feeding rate itself to determine if it's the NSC percentage on a feed bag versus the grams per kilogram of body weight of NSC the horse is consuming that may be causing this hyperinsulinemic response in our insulin dysregulated horses. So for this study, we utilized 15 horses. 7 of them were insulin dysregulated, and the other 8 were non-insulin dysregulated. We fed 3 different feeds during the first phase of this pilot. So the first feed was a low NSC feed, and it was about 7% NSC. The second feed was around 14%, and the first 2 were both pelleted feeds. And then the third feed was a lot higher NSC percentage, but it was a senior textured feed rather than a pelleted feed. And then we also took those same 3 feeds and fed them at 3 different feeding rates. So the first rate was 0.06 grams of NSC per kilograms body weight. The next was 0.11 and then 0.17. So once we evaluated all of this data, we found that the driving factor is actually the grams of NSC per kilogram of body weight in these individual meals rather than just the overall percentage of NSC in the feed. So this is really important so that we can inform not only our owners, but our vets making these recommendations that we really need to be calculating and focusing to look at how much NSC we are feeding these horses per individual meal on a grams per kilogram body weight basis rather than just the overall NSC of the diet. So we did actually see when we fed what would be considered to be a safe or low percentage NSC feed, we did still see that augmented increased insulin response when fed at the higher rate of 0.17 grams per kilogram of body weight. So again, just showing that we do see that increase even if it's considered a safe feed or a low NSC feed if you feed at a high enough amount. This study was also really important to look at the individual behaviors of these horses, showing that even within our insulin dysregulated group, we had varying responses to these feeds. So just because a feed is safe for one insulin dysregulated horse, it might not be safe for another insulin dysregulated horse if that horse is maybe at a more severe point in this stage.